Okay, so morning everybody. And my name is John. I'm in Mombasa in Kenya, an IACD member and community development worker and facilitator. I'm going to just give a very quick overview of what we're going to be doing today, and then I'll hand over to the various people who'll be leading us. But our idea was to look at projects that are working around issues of sexual health and rights with young people. So we've got several examples from both Kenya and Ghana, and several people who are going to be sharing more about what they do. After which we're going to have a little bit of time for some group discussions, so you can be thinking about what all this means to you in your context, wherever you are, and the work you're doing. So I think we're going to start with Ghana, if that's okay. We've got two people from Ghana. One of them, of course, is Emmanuel, our colleague in IACD. And we've also got Patience, who is from PPAG, Planned Parenthood Association of Ghana. And they're going to just share for about 20 minutes on some of the work that's going on in this field in Ghana. So I'll hand over to you first, Emmanuel. And then we'll hear from Patience as well. Emmanuel?
Okay, thank you. Due to my poor connection, I'll not be able to stay on video for too long. So I'll humbly plead with you to allow me to turn off my video so that I can be stable. My name is Emmanuel Obetsebi-Lamptey. I'm a member of the IACD and the convener for the Ghana chapter of Ghana's network of community development practitioners. That's the Community Development Practitioners Association of Ghana. And I'm privileged to be with you this morning. When we talk about sexual and reproductive health rights, we are talking about something that is very Patience and Puma from the PPAG. She will come after me and looking at the issue from a health perspective, and she will give us some practice insights based on their activities at the plan rights aspects. So basically, we'll try to scratch the surface of the legal framework and the laws.
Emmanuel, we're losing a lot of what you're saying.
About adolescents.
Maybe we can invite Patience to come in, and then we'll come back to you. It might be a little bit better later on, hopefully, if that's okay. Patience, right, so over to you. Sorry about that, Emmanuel.
Great. Unfortunately, good morning from Ghana. Unfortunately, I'm unable to show my face, so I'll just go ahead to share my screen. So as you may know, my name is Patience Ampuma, and I work with the Planned Parenthood Association of Ghana. I work with the advocacy unit, and currently I serve as the Family Planning 2030 Youth Focal Point for Ghana. So because of the limited time we have, my presentation is quite lengthy, but I'll just go into the basic parts. So basically, I just want to talk about the initiatives of PPAG when it comes to sexual and reproductive health and rights. So this is just history about PPAG. So PPAG works with young people. We work with and for young people. Our primary focus is young people within the ages of 10 to 24 years, both in and out of school. And we focus on men and women of reproductive age. And we are also a member association of the International Planned Parenthood Federation. Now, so this is just who we are. So our vision is to be the leading quality and sustainable SRH, our information and service provider, especially for young people and marginalized group in Ghana, and same for the mission statement. Now, it's important that I share our core values with you. So our core values include team spirit, volunteerism, youth-friendly, results-oriented. We have a rights-based approach in delivering SRHR for young people, and confidentiality is one of the things that we prioritize, especially in our interactions with young people. We do a lot of partnerships and collaborations, and accountability is very important for us because PPAG is a volunteer-centered organization. The organization doesn't belong to one person, it belongs to volunteers because of how it was established. So PPAG is a volunteer-based organization. we have the volunteers wing, and then we have staff. So that is why accountability is very important for us. And now, due to the emerging issues, it's important that we include gender transformative approaches into everything that we do in our programming, especially when it comes to putting together initiatives for young people. We ensure that the initiatives are gender transformative. So these are the things I already mentioned. Now, in our programming, we work with 4 basic pillars. So this is our strategic framework. When you take PPAG as a whole, we have 4 pillars that we work with, and I'll just run you through them. So our strategic framework comes from IPPF, because as I did mention, we are a member association of the International Planned Parenthood Federation. Our pillars are center care on people, that is the pillar 1, move the sexuality agenda, that is pillar 2, and solidarity for change for pillar 3, nurture the federation for pillar 4. All our projects find ways to fit into these 4 basic pillars. All projects that we have, or all initiatives and programming that we deliver for young people fall under either of these 4 pillars. So for center care on people, we are talking about expanding choice for young people. Expanding choice for young people, we are looking at when it comes to family planning services. We are looking at when it comes to comprehensive abortion care services. We are looking at when it comes to STI testing. We are looking at when it comes to LGBT issues. We want people to be able to have access to different options, to be able to choose what they want at their own convenience. That is what we talk about when we say expand choice. When it comes to widen access, access is also closely linked to choice, and that is what we are talking about in both instances. And advanced digital and self-care. For now, currently PPAG is running this FP self-care, and we are running self-care for comprehensive abortion services as well. So for FP self-care, we are focusing on the Sayana Press, and for comprehensive abortion care services for self-care, we are focusing on enabling people to have access to CAC anywhere they are through digital means. That is what we are doing with self-care and the center care on people. Let me move the sexuality agenda. Now, it is important to note that advocacy at the national level is very good for policy strengthening. It's very good to create that enabling environment that we need to ensure that policies, when it comes to SRHR for young people, is wholly accepted. But it is also important to note that ground advocacy is necessary to ensure the continuation of SRHR for young people. We need people on the ground to understand the issues so that when it becomes policies, we do not get a lot of backlash on the ground. Okay? So just as I was saying, under move the sexuality agenda we have shifting norms and acting with young people. Shifting norms is focusing on dealing with traditional and cultural norms in the community or in our society that do not sit well when it comes to our SRHR programming. So that is why we do the ground advocacy to shift those norms. And in shifting those norms, of course, we have to act with the young people, because nothing for us without us. We need to make sure that at every point, right from our design stages to evaluation stages of any project that we have the young people on board. Now, when it comes to solidarity for change, we are looking at supporting social movements, building strategic partnerships, innovation, and sharing of knowledge. So this is where we talk about exchanges, and just like what we are doing today, trying to see what Kenya is doing, trying to see what Ghana is doing. That is one thing that PPAG stands for. We are a member of a lot of international groups or a lot of international associations where at different points in time, we make sure that we are learning from each other and putting in place new initiatives that work elsewhere and we think can also work in Ghana and can benefit young people when it comes to SRHR. And the last pillar focuses on nurturing our federation, growing our federation, walking the talk, charting our identity. So that's where we are looking at ensuring that everywhere PPAG goes, we are doing what we are saying. So I'm not just sitting here and talking to you about comprehensive abortion care, talking to you about FP, and then my values are not like that. And I see a young person and I suck the person away, or our service providers are not youth friendly, or we are not open to young people when it comes to organization. No, That is why we have Nurture the Federation. So under this pillar, we make sure that all staff are youth friendly. Under this pillar, we make sure that our facilities are opened, very convenient for young people. We have youth centers and everything that young people want when it comes to SRHR. They are able to have access, affordability, looking at cost, all the issues that will serve as barriers to young people accessing SRHR. We make sure that under Nurture the Federation, we are working on that progressively. Right, so I'll move to the next slide. So these are our operational areas in the country. This is just a map of Ghana. This is the Ghana map. And as you can see, we are operating in more than 10 regions. We are operating in almost every region of the country. And in the regions that we are not fully operational, we do a lot of social franchising and partnerships. So we work with other organizations or other facilities that also provide sexual and reproductive health and rights to be able to reach out to young people because we are not fully operational in that particular region. So these are the strategies that we use in ensuring that sexual and reproductive health and rights is available for young people anywhere you are in the country or even out of the country. We do a lot of advocacy both at the national level and at the ground levels. When it comes to service delivery, we have static clinics. So PPAG has static clinics, about 10 static clinics across the country. As I did mention, we do social franchising, partner and associate clinics as well. So we have an initiative called the Reproductive Health Education and Services for Young People, known as RESI. So it's called RESI for short. Then we also do a lot of behavioral change communication, community engagements, and community sensitization, resource mobilization. Resource mobilization is important for us because we believe that as an NGO looking at the international space with a lot of donor funding that is dwindling, it's important that we are able to set our foundations very strong so that even if donors move away, we are still able to provide services for young people. So resource mobilization is very core for us, and knowledge management, institutional governance, media engagement, both new and traditional. So these are just some images so we can better understand the things I'm talking about. So when it comes to service delivery, you can see a nurse and then a patient right here, a client, sorry, right here. And the next image shows a group of young people having a discussion. So I was actually part of this discussion. This was just a discussion to produce a document for young people under IPBF. So these are other images as well. We have so where my pointer is someone from PPAG engaging with young people using the RESI approach. Then there's another young person in a community using our Girl Boss approach to speak. Our Girl Boss approach uses the human-centered design to ensure that we are providing solutions that meet the needs of people in the community. Now, when it comes to our digital health initiatives, we have something called Yenkasa. So Yenkasa is in our language and it means let's talk. So Yenkasa is a digital contact center with a toll-free number where young people are able to call anywhere you are in the country. All you need is a phone. It doesn't even have to be a smartphone, and you don't even need any connection or airtime. All you have to do is to just dial in the number. We pay for the charges and everything. The contact center is full of trained people who also speak diverse languages so that we are able to have large access and large reach to young people in the country. We also do a lot of social media engagements, and this is just a flyer, an example of a flyer to show what we did just very recently. And we also do have a podcast studio in our center or in our office in Accra. This is where we give space for young people to interact, to talk about issues that concerns them and their reproductive health. And then we air it on YouTube. We put it on YouTube for others to also engage, interact, and learn from it. So this is just a view of the podcast and some people sitting having a discussion. As I did mention, we do have the RESI chat room, and the RESI chat room is an initiative that came out from COVID. And what we intended to do with this was that because young people did not have access to move around to facilities for reproductive health services, we brought it to their WhatsApp. So we gathered young people on WhatsApp and we gave them education using language those who can speak English, that's fine. If you couldn't speak English, we did a lot of voice notes for young people in local languages so young people better understand. So that is the Resi chat. So let me just talk briefly about our contribution when it comes to family planning. So in Ghana, we have the National Health Insurance Scheme, and family planning for now is very important for us, especially because of our signing on to the FP 2030 global commitment. And for now, we have played a very remarkable role in ensuring that when it comes to the health insurance benefits package, now people have access to services using the health insurance. You don't need to pay. All you need to do is to go to the facility and you can have family planning services. And we are still doing a lot of advocacy to ensure that commodities are also being procured by government and not just in the donors in the country. Yeah, so basically PPAG also serves as the CSO focal points, and that is why this advocacy is very important to us. We want to ensure that as part of the FP 2030 global commitment, all people, young people, people in partnerships, people who are not married, as long as you are someone in the reproductive health age, you are able to have access to family planning services. And this is where I'll end my presentation. You can reach us on social media. We have our toll-free line. You can go to our website to learn more about us. And thank you. I'm hoping for patience.
Thank you so much, Patience. Let me quickly take over from here, and in the next 3 or 5 minutes I finish. So talking about the rights aspects, the 1992 Constitution of Ghana is a foundational legal document, and it has a summary of constitutional provisions that protect individuals from violence, including sexual violence. And so the Criminal Offences Act, which is the Act 29 of 1960, is the core legislation that covers sexual offenses such as rape, defilement, incest, and indecent assault, among others. Now, for the purpose of what we are doing for adolescents, we know that rape is for deals with sex with without the consent of a woman of more than 16 years. Defilement is having sex with a child below 16 years, and the consent is not an issue. Whether the child consents or not, there is an offense. So we are saying that the penalty for defilement is between 7 years, which is minimum, and 25 years, which is the maximum. For rape, it is 5 years minimum and 25 years maximum. Some observers have said that the one for defilement, penalty for defilement, is not deterrent enough and has to be looked at. There is also the Domestic Violence Act of 2007, and its purpose is to protect victims of domestic violence, including sexual abuse within families. And we also have the Children's Act, which are special protections for children, including safeguards against defilement and child marriage. And it also emphasizes the prohibition of sexual exploitation of children. There is the Human Trafficking Act of 2005, Act 694, which also outlines penalties focusing on sexual exploitation. And it is important as a law in preventing trafficking for forced sexual labor of children. Support units and its role of the gas and its and providing support for vulnerable groups. And they've really had a great impact on enforcing sexual rights and providing victims help in these things. So that's about a quick overview. And so especially
Emmanuel, we're only getting not even half of what you're saying. Emmanuel.
Oh, you don't hear anything. Oh,
no, it's the same problem. It's just coming in and out. Eh?
Yes, I'll just.
Yeah. It's sorry about that. Eh? Yeah. So thank you. Anyway, I mean, what Emmanuel was doing was giving some of the legal framework, of course, and we were supposed to have a speaker from the, I'm not sure the title, but the Victim Support Unit from the Ghana Police was to come. So that was a little bit from there. But thank you very much to Patience. That was a wonderful presentation. and lovely to see all the work that you're doing there. Personally, I really enjoyed the pictures because the pictures tell such a great story. It's so much more powerful than words sometimes. Before we go to Kenya, is there any quick comments or reactions? And we'll have more time to discuss later to what you've heard so far. Maybe 1-2 people. If anybody would like to come in with any comments or questions.
Hello, moderator. Hello.
Yes, please go ahead.
Odartey from Benin, Nigeria. I didn't quite catch up. What's the acronym PPAG? I'd like the speaker to tell us the full meaning of PPAG so that we can follow up. No doubt they are doing a great work in Ghana. So that's my first initial comment.
Yeah, so PPAG stands for Planned Parenthood Association of Ghana.
Okay.
Yeah, but we are undergoing a process to just make it PPAG. You understand? So now we go more over the PPAG instead of saying Planned Parenthood Association of Ghana.
Okay.
And it's part of an international federation. So you'll find PPAs in many countries. I know I used to do some work with PPASA in South Africa, for example. Yeah. Okay.
Yes.
Thank you very much. We've got some nice comments and thumbs up in the chat for you, patients. So that's great. And as I said, we'll get into the discussion a bit more later. But let's hear a little bit from Kenya now. I believe Phoebe is going to give us a quick overview, and then we've got another speaker called Sheila, who's here as well. So Phoebe, let's start with you. Phoebe works with VSO in Kenya. So Phoebe, over to you.
Thank you, John. I hope you can hear me.
Yeah, sure. Yeah.
Okay, great. Hi, everyone. It's nice to see everyone on this call and excited about the discussions and the conversations that we are having today around sexual reproductive health. My name is Phoebe Mbithi. I work with VSO here in Kenya. I am the Social Accountability Advisor supporting sexual reproductive health project called the Make Way Project at VSO. But at VSO, we have other health projects that we run. So today we'll be sharing a bit about how we monitor health services and also how we utilize volunteers, to enhance sexual reproductive health services, to improve them, to capacity build the communities, and even to monitor policies and budgets here in Kenya. So probably I'm having a few people in the room. I'll just like Catherine for just a second to say hi, if possible, or to just type in the chat. I don't know, Catherine, are you in a good place? Okay.
Thank you so much, Phoebe. Good morning, everyone. Nice to see all the faces. My name is Catherine Jenga, a colleague working with Phoebe at VSO. Really looking forward to an interesting discussion. Thank you.
Thank you, Catherine. Okay, so basically here at VSO, most of our programming are supported by volunteers, and we realize volunteers are very key when it comes to working in the communities and how they influence the communities. And at VSO, we have different types of volunteers. So we have international volunteers who come from different countries to support work in specific countries. Let's say like Kenya, we have volunteers who come in maybe from the Netherlands, from the UK, from all over the world to just come support. We have national volunteers who are majorly based nationally at the national office, but they support county work. Then we have community volunteers. And interestingly enough, we have volunteers who are provided by the government who are called community health volunteers, who also currently have been shifted to community health promoters, who do a lot of work around health service delivery, information dissemination in the communities. So most of our volunteers at the national level, they will do most of the capacity building of issues around sexual reproductive health to community volunteers and even to community themselves. Most of our sexual reproductive health programs here at VSO are working with young people between the ages of 15 to 24. So we monitor most of the services that are for those young people. And interesting enough, majorly for our project at Makeway, we are very keen on the intersectionality aspect of sexual reproductive health for young people. So this is where we are saying, despite all the identities that young people are facing, they all have equal right and they need equal opportunity to receive services without any discrimination. So with these different channels of volunteers, we have been able to engage our own community volunteers who do majorly most of the mobilization of communities. They do a lot of capacity building, and even some of them have even supported in monitoring where we have legal issues that are having, let's say, for example, a young person has been defiled. Do they know the right channels to approach? Do they have the right information on where to go when such a situation happens, what to do, and making sure that this is followed to the latter. They also play a critical role on capacity building our healthcare providers. So you will get most of these volunteers are the ones who, go back to train most of our healthcare providers on key issues or key documentation or key new things that have come up. Either these are policy documentations that have been put in place by the government, or these are, maybe new directives that have been put in place and the service providers haven't gotten a chance of maybe being trained or this information being disseminated to them. So our volunteers play a critical role in connecting the community to the right information, connecting the community to the right services, and even connecting the community to legal places where they need to approach when they have different issues that are happening. We also try in some of our projects to offer services. So you will get some of our projects, we do distribution of sanitary towels to our young girls. We do distribution of protective gears for our service providers. These can be the nurses, the community health promoters when they need something like the overalls that the coats that they wear, the aprons that they wear, and all that. So you will see most of our work is volunteer-centered, where we believe that volunteers are also our agents of change, and they do most of the works that we have in our communities. Despite us working with volunteers, we have grown because we believe in the ripple effect. So the information we have, we don't want it just staying with us. Most of these projects grow over time. Most of these projects sometimes end and they sometimes shift. So we have ended up capacity building more youth organization in our different counties where we work in. So for those who don't know Kenya, in Kenya we have counties which are like our small administration blocks. So we have worked with youth organizations that bring more other organizations and more other young people as allies to, disseminate more information, do most of the monitoring work that we do. And today with us, we have one of our representatives from a youth organization called Youth for Sustainable Development organization that is working with young people in Kingsley County, who will talk a bit on some of the work they have done around monitoring sexual reproductive health services and how they have been innovative. Sheila, welcome.
Yes, I don't know what time is it, but it's good morning still here in Kenya, in Kilifi. So I have just put on my camera to say hi, then I can switch it off so that I do not go off online. So my name is Sheila. I work with Youth for Sustainable Development, which is one of the implementing partners working with VSO here in Kilifi County. So our work around what Phoebe has mentioned, that is social accountability, is divided into 3 avenues. So we have one aspect in terms of policy advocacy. And in matters policy advocacy as a youth-led organization, our main area of focus has been under health, specifically what is commonly known as RAMCA, that is reproductive, maternal, adolescent, neonatal health. And our cohort of focus is basically young people, that is women and girls, and also those with compounded vulnerabilities, who in terms of seeking services, and we went further to target young people who were accessing these services at the hospital facilities. In this case, we are calling them youth-friendly centers. So youth-friendly centers, these are hospital facilities, either in the main hospital that are set aside just to enhance and also as a way of enticing young people to go for sexual reproductive services. So we have so far worked in 3 administrative wards, that is in Kilifi, Mtwapa, Matangoni, and additionally Rabai. Then another aspect that we're also working in is in terms of budget advocacy, where we are also tracking and also pushing for the county governments. And in this case, is the county government of Kilifi to increase their budgetary allocations for RAMCA services in the county. Then the other aspect is also in terms of service delivery. And in terms of service delivery, we are talking about it in 2 aspects, where one aspect is in terms of demand generation. So our hope while we are working in the social accountability is also just to give information. So this is sexual reproductive health information and education to the young people and the youth, so that they are able to demand for these services at the youth-friendly service centers. Then the other aspect is also in terms of ensuring that the services that they want to access are effective. So in terms of now working in terms of ensuring the services are effective, this is now where we employ one of the Mekwe tools. We are calling it the Intersectionalized Community Scorecard, which gives us an avenue to work with the young people as well as also the duty bearers in terms of just assessing how are the services given at the point of service, that is the youth-friendly centers, and if they are given, what services are we talking about? Because for those of us who work in the sexual reproductive health focus, you know that there are different services. For example, we find that there is nutrition, there's also immunization, and then there's also the part of commodities, for example, access to condoms, access to HIV testing and counseling. So those are the avenues that we are working with. And we're using the community scorecard because it gives us an opportunity of bringing both the service user and also the service providers to one table to ensure that they are able to, 1, track the services that they are giving, 2, also track how many young people are able to access the services, and then 3, are they effective? So the scorecard has several steps, and I'll point out to key steps in the scorecard is 1, a meeting with the youth, the service users, in this case it's the youth, where we are able to sit down with them. They are able also to highlight what is the case scenario of the areas that come in. For example, in Kilifi County, the young people are able to sit down, they're able to map out what the sexual reproductive health rights landscapes looks like in Kilifi. And this includes even analyzing policies that are there in the Kilifi counties. And you might be asking yourself why policies. We are saying policies is very key because it is the policies that, for example, translates to the budgetary allocations that I had mentioned. It is through policies that you are able to demand for the county government to be able to put allocations towards sexual reproductive health. Then the other important key step in this intersectionalized community scorecard is a meeting with also the service providers. So here we are saying this is a case in point where you need to hear both sides of the stories and hear the service providers as well. They are able now to also have an opportunity for them to look at how are they providing their services, and they're looking at this as part of a component of the scorecard called the scoring. So the young people will be able to score against the services, as well as also the service providers will be also able to look at the services. Then after that, now we have another component, which is called the interface, where we are able to bring both parties, that is the service users and service providers, and we are able to chart a way forward from the scores that were given. How do we move on? For example, if an issue came about in terms of probably attitudes of service providers, which is what we get commonly, in terms of, are they friendly when offering the services? Are they trained in knowing how to offer youth-friendly services? So we are able to sit down and collaboratively now come up with an action plan where we are able now to follow up the progress. And in following up the progress, we constitute something that we are calling the joint monitoring committees. And the joint monitoring committees are made up of service users, that is the young people, and also the service providers. So periodically then they are able to meet at their facility level. And you're saying they should meet at the facility levels because one, they know better how the facility works. So periodically they'll be able to sit down and check their balances against the action plan that they were able to come up with, and also just checking their progress, how are they progressing from the time that they had the scoring and the joint monitoring meeting that they had. And from there also now is where the young people are also able to pick other advocacy issues that they can decide to run with. So Phoebe, I'll leave it there unless there is any question, then I can take it from there. Thank you.
Thank you very much, Sheila. Thank you for that. And nice to hear some of the practical things you're doing there. And by the way, mimi niko jirani yako, niko hapa Mombasa, so asante.
Yes, John, it's nice to see you again. We met during when you were in Mega and Kwacha. Thank you.
Oh, good. Oh, good. That's nice to know. Okay. Yeah, thank you, Sheila. All right, so we've got a couple of minutes left, and I think Catherine's going to come in and wrap things up from the Kenya perspective.
Yes, thank you, John. Thank you so much, Sheila. Thank you, Phoebe. We've at least managed to give a snapshot of what VSO and the Make Way program is all about. There are a lot of intersecting challenges that the Make Way, VSO, and our collaborating partners such as Youth for Sustainable Development Kilifi are trying to achieve. We believe that sexual and reproductive health is not a single issue. That's why we are applying an intersectional lens to solving both in the demand creation of SRHR products as well as on service delivery, to what Sheila has done a splendid job talking about our work with the scorecard, bringing in all the stakeholders from the policy and duty bearers, making sure the centers are youth friendly. So in conclusion, we welcome you to visit our website, both the VSO website and the Make Way website. You'll see, despite the intersectional community scorecard toolkit, we have a couple of toolkits too. We do a lot of work with religious leaders to get public support for SRHR. We also do public policy analysis, international mechanisms that align with sexual and reproductive health. So really looking forward to the questions and feedback about our work at VSO and the Make Way program. Thank you so much.
Thank you, Catherine, and thanks to the Kenya team. 2 minutes left, so that you've really kept time well. That's wonderful. Any quick comments or reactions to the Kenya team from what you've just heard from Sheila and Catherine and Phoebe? Anybody like to come in? Some clapping going on. Okay, so what we're going to do now, we've heard quite a bit from Ghana, quite a bit from Kenya. We're going to just have about 15 minutes in small groups, and we're going to divide the people that you've heard from. You'll find one of them in your group, basically. So it's a chance to think about what you've heard, ask more questions, but also talk about what's happening in your context. It's a very I don't know the right word, but sexual health and rights is always a hot topic. You know, adults always worry about young people's sexual health. And I can remember that when I was a young person, the adults then were like, oh, young people, oh, you know, having sex. It's it's not quite a taboo, but it's a sensitive topic, let's put it that way. And I see the same thing happening many years later, the same patterns repeating themselves. It's quite interesting. So I know our group is back and a few others. We just wait a few more seconds. Welcome back, everybody. We have a few minutes left. In fact, we've got 15 minutes left, which is good if we need it. I was lucky to be in 2 different groups, and then we reshuffled the groups a bit, but some great discussions in both. So that was really interesting, but I'd love to hear a few reactions, you know. What were some of the things that you got from the group discussions? What were some of the highlights that you think would be worth other people hearing about? We don't need to go around group by group, just anybody who feels to share, please do so. Let's start with Hamidou, over to you.
Oh, thank you very much. We had presentation from Group 1, from Ghana and Kenya, and our major concern is the level of synergy between the association, the volunteers, and the community members. While in Ghana, why all the places there seems to be a collaboration with religious leaders and the rest of them. But our concern is the level of youth involvement in the activities. Though youth are part of the volunteers and the rest of them, but how far have this thing been stepped down to those in the rural areas and people with disability and the rest of them are some of our issues that we feel has to be addressed. And then the other aspect is the cultural aspect. You know, the law says 16 years and the rest of them. Then what of the people? Do they seem to accept that or not? Because in some communities, obviously, a girl will be even 14 or even 10. But if you look at her, you think that she's even 20 or 25 years old. So how is the community looking at those issue of the organizations looking at those issue of age as issue concerning sexual harassment and the rest of them? Thank you.
Thank you very much. Thanks for that. Yeah. Very pertinent issues in many countries, yeah. Let's hear from somebody else. Anybody else like to come in and share some of the points from the discussions you had?
Hi, John. Good morning and good afternoon, everyone.
Morning, Stella. Hi.
Ours was group number 4, which basically we had some Kenyans, we had someone from South Africa, and our concern, or basically what came up is more or less with what Hamidou had in their group, where our concern was, or the point of focus was, these criminal offenses and the various criminal activities that pertain sexual rights and the sexual activities. Why is it much of it being done by volunteers and not the mainstream government? So that even as the mainstream government comes in and they set a ministry for it, set different policies for it, and even have a criminal justice system for it, why is it that much of the volunteer work is also still based on the sexual activities within our communities? Which part of it, our cultural perspectives also, how much do they come in and help us either to reduce it or facilitate the continuation of these sexual activities within our communities? So basically the main concern, if possible, if you can be able to respond to it, is all about the role of the government versus the volunteers, and then our culture. What is the contribution of it when we try to talk about this sexual abuse within our communities? Back to you, John.
Thank you, Stella. Thank you. See quite a few things coming up in the chat. Janine, do you want to say a bit more about some of the points you've raised here?
Thank you. Thanks, John. Yeah, in our group, it was interesting to get onto the cultural issues and how, even though the laws might be there, if there's a very rural community where incest is taking place, even with children as young as 10, those things are not spoken about. You know, it's the whole taboo thing. So then how does the community, how does the government even deal with those kind of things? And then that led to my question of, like, we're coming up to the 16 days of activism. I don't know how many of the countries all support that, but it feels like we've been here before. And how much is changing? You know, are we doing things differently? Are we coming up with different strategies to deal with things? Or is it the same battle and the same hard work being done on the ground level with not much change happening? And I think one of the, I think it was Sheila who mentioned that there's a sense of ownership on the ground for people who are involved at community level. And that's great, because I think that is what changes things. But, you know, I think generally the overall policies and ways of working with things feels like same old, same old.
Yeah, and I guess my comment earlier alluded to that. You know, there's always a big scare around sex and young people, you know, with every generation. I wonder if it was the same when my parents were young, you know?
Yeah.
And I grew up in Europe, I grew up in UK, and it's the same moral panic, you know? Oh, young people having sex. Oh, some of them are gay, you know, as if these are terrible, terrible things, instead of really trying to take a mature approach to the whole thing. Yeah, and personally, that's one of the reasons I got involved in youth work at a very young age, because I could see very limited information around for teenagers. This sense of we can't talk about certain issues. Where can we talk about them? You know, and I think that's probably one of the big issues that made me really get into community development work in the first place. Yeah. All right. Any others? Anybody else like to share? Any thoughts? I'm always happy to hear new voices. So Rachel, it'd be nice to hear a little bit from you, and maybe Hyacinth, if you've got any thoughts.
Okay, thank you so much, John. Yes, I was happy to be in the group 3. It's my first time attending on any of the meetings. And I think the points raised were mentioned, the ones which Janine has spoken about. So I'm just listening on. Yeah, thank you.
Okay, thank you very much. Thank you very much. Okay, I think I'm going to hand back to Daniel now, because we've got the last few minutes, and he'll wrap things up for us, and maybe if there's any announcements or any other information to share. But I'd like to thank all the presenters, some of which we've lost, some of whom we've lost. They must have dropped off, but it's been quite a rich session, you know, lots of interesting examples and discussions going on. So thanks not only to the presenters, but everybody who's participated in this. Been a nice session. So Daniel, over to you.
Thank you, John, for taking us through this session. Quite enriching and discussing a topic often not discussed. And it's very easy for the youth. And in this case, we have also discussed issues relating to children just being overlooked or glossed over, largely because of socio-cultural issues, or in some cases, children also have become invisible. Yet, when you look at the demographics, then it's a demographic that cannot be wished away. Looking at the African demographics, the under-15s constitute 40% of Africa's population. When we add the 15 to the under-35, 22.7%, then that brings us to 62.7%, the children and the youth. That's about 2/3 of the African population. And so issues affecting that kind of constituency then cannot be wished away. And when it comes again to issues of rights, then of course we can't be talking about community development if the issues of that segment of population, the greatest percentage and the greatest potential for society, is not addressed effectively. And so I'm so grateful that John and Emmanuel, you have been able to put this together with your colleagues, Patience from Ghana, and Catherine, Phoebe, and Sheila from Kenya. And all of us, again, through the participatory process that John is always great about, making us all co-presenters and in this forum. It's been a great 43rd edition of IACD Sub-Saharan Africa webinar series. And as I've indicated in the next steps, we are going to December, which normally is our open forum, so that we can be able to review where we are and also be able then to vision where we want to go as a region and as IACD members in this side of the world. And equally, we are already into January 2025 on 8th. That's the second Wednesday of January. We'll have a presentation on, again, issues related to human rights, housing, and more so in the informal settlements, which again, if most of the urban areas are like ours in Kenya, 3/4 of the population of Nairobi lives in informal settlements. And so again, that's a category of population you can't wish away. And there's a lot of community development going on, much of it also very informal. And so you're welcome to the open forum in December. And then we start the year with a presentation on, again, issues of human rights, housing and informal settlements and community development. And so thank you so much for walking the journey over the year and over these years when you are talking about, we are moving out to the 44th edition. And thanks so much, Jessica, for always supporting us, waking up so early to get everything going on for us. You know, it's more than the call of duty for you. And thanks so much. And colleagues in the ICD board, Janine and Abdu, thank you so much for the support. Colleagues, this is our forum. As we now plan for 2025, I'm inviting all of us, if you have a topic of interest, kindly get in touch, we schedule and keep on moving forward. We've earlier on talked about a book edition that is under discussion, book chapters centered around the presentations. We've quite a bit of abstracts already in place. We are preparing a proposal. If it is successful, again, it's also another milestone, but more details will come through. Possibly by the time we meet during the open forum, we'll have more concrete details on where we are going with the book. So thank you so much and enjoy the rest of the day.
Thank you, Daniel. Thanks, John and team.
Thanks, everybody.
Thanks, everyone.
Thank you.
Have a great
Yes,
day.
thank you.
Thank you.
Bye. Thank you.
Bye.